Welcome to this episode of Youth Diary. Today we have Dr. Tom with us, who is an orthopedic surgeon associated with Rajagiri Hospital. Welcome to the show.
Thank you. Thank you, Deepa, for making me a part of this show.
Well, we have around 206 bones. So we're going to deal with those bones today, one after the other. We have a lot of questions for Dr. Tom. Dr. Tom, do you have any common orthopedic problems with which people come to you?
The common problems, mostly I feel backache is the commonest, and at par will be your neck pains. Also, people come with your multiple joint pains, knee, elbow, ankle, heel, and all those sort of pains. Okay, then again, aches and pains related to sports, either sports injuries or maybe after people, they may not be a sports person, they go for some sports or running or maybe marathon like that, and then they come with aches and pains. I feel anyway the most common will be these backaches, neck pain, and your multiple joint pains. Yeah.
Neck pain, when you talk about neck pain, is it related to a profession, or like basically if there is any precaution for that?
See, talking about neck pain, before answering that question, you should know something some basic stuff regarding your neck. Okay, see, our neck has got a curve like this. Okay, so if you look straight, that curve will be maintained like this. Okay, and it's your muscles, neck muscles, which keep your neck straight. Okay, and any profession which demands the neck to be in a stooping position or in a slightly bending, okay, then the neck can ache. Okay, so of course people who are in front of the computer all the time, maybe IT professionals, okay, they'll be using the keyboard again, looking here. Okay, so again they tend to get neck pain. Also hairstylists, okay, they'll be bending a little down. Yeah. Even tailors, such. Okay, and also we have seen there are people who loves to watch TV lying down. Okay, they'll be lying on a couch or in a pillow or something. So again, the neck will be like this. So again, same problem. Okay, even people again loves to read, especially for exams and all. They'll be reading lying down. Again, same, the neck will be in this. It's called flexion. Okay, it will be in flexion. Even people who use thick pillows, okay, again they can also get neck pain. So these are the common. So
is there a way to avoid such frequent neck pains and all?
See, you have to see. I already told you there's a curve. So maintain your curve. So almost your neck pain will be sort of, especially while.
So doctor, do you think consciously it is possible for us to?
No. So you have to make it a habit. Okay. So professionals again, especially who are in front of a computer, make sure your. Of course, you should take frequent breaks in between your busy schedule and just try to relax.
So I think audience, what you have to understand is that you need to make conscious effort to.
Yeah, a little bit. Yeah. Make some conscious effort so that it will become a habit. Okay. Yeah.
Which is actually going to be good for you long run.
Yeah, fine. Unless it's a habit, it keeps recurring. And once you get back neck pain, if you have a tendency to get neck pain, then you have to first of all correct posture, then exercise. Yeah. Okay, so you have to do proper neck exercise. That is the second thing.
So doctor, what are the warning signs when you have to understand it has become more critical?
See, all these cases I just told, so almost maybe 60 to 70% of the neck pains will be due to all these postural problems and all. But we do get little problematic cases. See, if your neck pain is coming down your shoulder, arm, forearm, hand, it means you have to be careful. Okay. Plus, if your neck pain is associated with any weakness, again you have to be careful. then very intense pain and pain not coming down at all, maybe a couple of weeks, still again you have to be careful. You have to meet your doctor, you have to get an X-ray, or even if you can get an MRI done, and depends. So see, depends on the findings. So you may have to undergo the treatment as such. So that depends on the stage. Okay, maybe from some medication, some traction, or even in some cases maybe surgery.
So after neck pain, I think what we have to touch is the back pain, you know, because back pain is prevalent in the youth, in the middle ages, and also the old ones. So when do you actually understand is this the critical time, you know, to go to a doctor, you know, because everyone has that back pain, but I think people take it simple and they take it as if it's part of their life. They can adjust with it. But I think there's a point where you need to understand that now we have to consult a doctor. When is that cutoff time?
Yeah, I feel to know back pain better, you can just classify this back pain into two types. Okay, you can say mechanical back pain and non-mechanical back pain. Okay, so your mechanical back pain, see pains in which the usual are posture problems, some disc problems, some spondylosis problems. This mechanical problem, it increases with activity. See, you go for a walk, or you do something bending, or you do some jogging, severe pain, and it will get relieved by taking rest for some time. Okay, that is your mechanical pain. Then you go to your non-mechanical pain. See, non-mechanical pain means you have the pain all the time. Okay, see, but activity can increase it, but rest won't relieve it. Okay, so even if you take rest also, you have the pain. So between mechanical and non-mechanical, see, non-mechanical pain has to be evaluated. See, you have to get an X-ray done or whatever evaluation. So non-mechanical, you have to. Then in mechanical, as I told you for neck, see, the nerves coming to your legs comes from the back. As your nerves to the hand comes from neck, your nerves to your legs comes from the back. Okay, so any pain, any back pain which is coming down to your legs, plus any back pain in which you got any weakness of your legs, plus if you are getting any problem with your bowel or bladder control, okay, these are very warning signs. Okay, so such type of mechanical pains also you have to be careful. Rest of the back pain, just back pain after bending some time or playing something, that I can wait for some time. Okay, you can do our normal precautions, all those things. But non-mechanical pain and mechanical pain in which there are some red flags, you have to be careful and you have to get a medic's attention.
So do you think there are any precautions that we can actually take for?
See, precautions again same, like your neck, again see,
keep your posture right.
Yeah, posture right. See if we are walking in two legs, right? See, because of this erect posture we are getting backache. See, if you have been walking in four legs, you should have never got backache. So see, to stand straight, your entire torso has to be straight. Okay, so your muscles make us straight. Okay, so to make us erect in this posture, our muscles are the core muscles. Okay, your back and trunk muscles. Okay, so by building up your trunk muscles, your back muscles, that is the best way to tackle backache. And the simplest way to strengthen your back muscles will be simple walking. Okay, and plus even you can there are simple spine strengthening and mobilization exercises also that you can do.
Yeah, so any specific exercise in particular? Because
see, I think there are you should keep your spine always flexible. There are some mobilization exercises plus mild strengthening exercise. See, other than walking, I think you should get a physiotherapist or a doctor's help to just, because unless you demonstrate you won't be able to know, because doing it in a wrong fashion also can aggravate your this one. So get somebody's help and know the things and do it on a regular basis. That's it.
And I think you all will agree with me that, you know, whenever there is back pain, you all say that you should not lift anything very heavy.
Yeah. It's a point. See, actually, see, people who have already got back pain and they know that they are prone to get back pain. See, there are a few precautions. Okay, one is never lift anything bending down. Okay, see, somebody gives you on weight on your hand, you can just carry it and go, but you should never lift it from down. Okay, one thing. Second is you should not do prolonged bending and do some work. Okay, and either you can just bend it and this one, otherwise what you can do is you can bend at your knee. Okay, so you should not bend too much at your spine level. Okay, so again, third thing is sitting. Okay, you should not sit without support. So always while sitting, make sure your back is supported well. So these are the three things. Okay, no lifting weight, bending down, never bend down for prolonged periods, plus no sitting without support. So three, be careful.
And doctor, wanted to ask you also about the surgery part. So I've heard that back surgeries are also done. So
yeah, see, when it comes to treatment, see, like your neck pain, see, initial things you can treat with your tablets. Again, pain running down your legs, as I told you, may need some traction, or maybe some kind, sometimes some belt like braces also will be helping. Okay, so these braces should be used only for a short period of time when there is severe pain, maybe 3 weeks or 6 weeks. So prolonged use of braces are not at all recommended. Okay, because I already told you, it's your muscles that keep you well regarding your back. So if you use your brace belt, so the strength of our core muscles will decrease. So no bracing more than 3 to 6 weeks. Okay, and you can use when you have got a severe back pain, you can use it. Or if you are expecting your severe pain while traveling and all, you can wear for some time. Regarding surgery, see, you should know when you need surgery. What are the indications? Okay, so it's not the common usage. It's not a magic wand. Okay, so you need to know what is the indication. So when back pain is associated with, as I already told, weakness, or if back pain is associated with any loss of control of your bowel, bladder, or a back pain, severe back pain not reducing with any of the other measures, you may have to do surgery. But even after doing surgery, that thing is taken care of. After surgery, again you have to do all these precautions.
Yeah.
Okay, do proper exercises.
Very careful.
Yeah, carefully. Do proper exercises. You should be near normal. Okay.
So this is like time for us to listen to few queries.
Hi, my name is Sandeep. I am from Kusat, and my question is how to avoid getting frequent neck pains.
Okay, as I already told you, see, the main thing about neck is your posture. So first thing is the maintenance of your correct posture. Okay, so all the precautions I already told. Second thing is neck exercises. So two things: correct posture, regular neck exercises. Okay, so these are the two important and the most important things, so that you can avoid getting frequent neck pains, I feel.
Alright, that was again something that you have to be very careful with. The second query is,
Hi, my name is Adarsh. My question is, what are the common causes of back pain?
Regarding back pain, it's one of the most common problem. As I told you, almost everybody in this earth might have experienced at least one episode of back pain. Okay, so the causes can range from a simple faulty posture, and it can range to severe problems like infection or even tumors like that. Okay, so it's entire range is there. Okay, so what you have to be careful is what I've told you regarding that mechanical, non-mechanical, that classification. Okay, so there are n number of causes, but the most important, okay, most common, maybe more than 80 or 90% of the causes, okay, to say maybe due to this mechanical problem, faulty postures and lack of exercise, all those things. Okay, and only the rest 10% all these problematic things come. So the common cause for, I think, in the young population, I feel that it's lack of exercise, then faulty postures, all those things. Okay, when you consider the majority 80%. Okay.
The next query is.
Hi, I am Gopakumar from Kusat. My question is, which are the common sports-related injuries?
Regarding sports-related injuries, okay, I should classify. I should tell it's sports-related problem or sports-related ache. The common problem with people will come is, see, most of the people won't be a sports person. Once in a while they'll go and play 2 games of badminton, or they'll go for, as I already told, they'll go for marathon, okay, all those things, and then they'll have severe pain and backache maybe for 3 weeks, 1 month, even knee pain, okay, it will ache all over the body. That is a common thing, okay, but it can have, see, sports related injuries can be very devastating also, can range from even fractures you can get, ankle fractures, knee fractures, and major ligament injuries in the knee, in ankle, and it can range from, see, even you have seen death in the sports field, okay. So most common is this not properly warming up. See, the reasons to cite: not properly warming up, and no regularity, once in a while only go, and most of the time they'll push too much their body, okay. See, if you are not a frequent sports person, make sure you start in small bites, okay, and but gradually you increase your timing.
All of a sudden getting into the exercise mode is also not great.
Never push too much, okay, and if you think that you got injured or something, take rest and do your some muscle strengthening exercise, slowly come back only, okay. No, never come back to sports in a haste, okay. You work up well, you tone your body, then it will come back, okay. Tennis elbow, most of the people will know the name because Sachin Tendulkar had it and he got operated for it some time back, okay. And see, even if the name is tennis elbow, it frequently comes in tennis players, but doesn't mean that it comes only in tennis players. It can occur in anybody, okay. See, your muscles which move your wrist upwards, okay, it comes from your outer side of your elbow, okay. See, when you got some kind of an inflammation, in this area where this muscle originates, you get this tennis elbow, okay. See, so the person will be having severe elbow pain, okay, especially while gripping or excusing clothes, or even you won't be able to do anything. Of course, no sports also, okay. See, the treatment part is, see, initial things, you can apply some ice, do some regular pain medication, and usually 30 to 40% of people will somehow get some relief with all these things, okay. But still there are people who won't get relief even with this ice and so-called tablets, okay. And such people may need a small injection here, kind of cortisone injection. Most people may benefit from that, okay. The only problem is they may experience severe pain for 1 or 2 days after the injection, okay. Otherwise, most of the people, 80 to 90% of the people will settle with these 2 things. But still, is a professional player like Sachin and all, okay, still pain is not coming down, you may have to do a surgery. That is the next step, final step, okay.
We are through with the queries, and it was really great to know a lot of information about the 206 numbers that we have in our body, their bones. So, is there any message that Dr. Tom you want to give to the audience today?
See, I feel the most important problem, okay, in the younger generation now, I feel it's the lack of exercise, okay. Exercise in the sense lack of proper exercise, okay, and of course improper diet, okay. See, as I have discussed, even if it is neck pain, back pain, when it comes to even your knee pain also, or any pain, exercise is the key, okay. So the muscles around the joint, is the one which determines the strength of the joint. Okay, so exercise well. Okay, and exercising also, as I told, it should be a regular exercise. Okay, and
not that once in a blue moon
yeah,
you're doing it and then you don't do it. Irregularity also creates a lot of problems.
Whatever it is, do a small step, slowly increase, and it should be at least 5 days in a week. At least walking is the best exercise. Okay, that can keep up and turn up your neck muscles, back muscles, and entire even your lower limb muscles. Okay.
It's time for us to conclude this episode. Please send your queries to youthdiaryroseball@gmail.com. We'll be waiting to see them. See you next week. Bye bye.